Cosmetic gum reshaping used to rely on a steel blade to physically tear away tissue. Today, that mechanical cutting action is being replaced by a highly focused light beam that glides over the surface, vaporizing tissue cleanly. For decades, treating a gummy smile meant enduring a traditional gingivectomy. That meant scalpels, sutures, significant bleeding, and a painful 2-week recovery, where even drinking water felt uncomfortable. Premium dental clinics in markets like Muscat have heavily adopted a modern alternative to bypass that ordeal: laser gum contouring. If you have dental anxiety, the appeal is obvious. You walk in, the dentist reshapes your gum line, and you walk out an hour later. No stitches required. But the technology itself cannot guarantee a better smile. A laser minimizes physical trauma, but is completely useless if applied to the wrong facial structure. To understand where things go wrong, we have to look at this chart mapping out cosmetic dental procedures. We're measuring invasiveness on the vertical axis and cosmetic impact on the horizontal axis. Traditional surgery sits right here. It delivers a solid cosmetic result, but it requires high physical effort from the patient to endure the procedure and the healing process. Laser contouring drops dramatically down the invasiveness scale. It achieves the exact same cosmetic impact, but eliminates the massive physical burden. Upgrading from a scalpel to a laser entirely solves the physical pain problem. But because the procedure is suddenly so easy to perform, it actually increases the risk that a dentist will cosmetically alter your gums without evaluating the true root cause of your gummy smile. In clinical practice, laser gum contouring replaces the steel blade with a focused dental laser, typically a diode or an Yag system. The reason patients recover so quickly comes down to one specific biological advantage. Let's look at this comparison table. Notice the immediate post-operative differences. A scalpel results in moderate bleeding and requires stitches. The laser requires 0 stitches, and bleeding is heavily minimized. As the focused light removes excess tissue, the heat actively cauterizes and seals the tiny blood vessels behind it. You aren't leaving the chair with open wounds. The pain management is also highly predictable. The area is numbed with a standard local anesthetic, so during the actual cutting, you feel warmth and slight pressure rather than sharp pain. There is a required trade-off. The lack of stitches means you have to protect that freshly cauterized tissue. You will have to stick to a strict soft food diet and avoid brushing the immediate area for 24 to 48 hours. You are trading the long, painful ordeal of surgical incisions for a very brief, heavily controlled window of physical healing. That speed and comfort create a financial trap. Because it's a fast procedure, clinics push it. But applying a soft tissue laser to a skeletal or muscular problem will ruin your smile. This decision tree shows 3 distinct causes of a gummy smile. First is altered passive eruption. This is purely a tissue issue. Your teeth are normal size, buried under excess gum. If you fall into this green category, laser contouring yields an excellent result. The second root cause has nothing to do with your gums. It's a hyperactive upper lip that lifts higher than average when you smile. If a dentist uses a laser to cut back your gums, your lip will still pull up aggressively when you smile. You will simply expose sensitive tooth roots, creating structural damage without actually fixing the gummy appearance. The third cause is skeletal, excess vertical growth of the upper jawbone. You cannot burn away bone with a soft tissue laser. Skeletal cases demand referrals to an orthodontist or a maxillofacial specialist to actually adjust the jaw. Even if your anatomy is perfectly suited for the tissue branch, there is one absolute deal breaker: active periodontal disease. Cosmetically reshaping infected, inflamed gums seals bacteria into the tissue and masks the visible warning signs of bone loss. It guarantees severe structural complications later. Booking a laser appointment without proving your face matches the tissue-only category is a gamble with your long-term oral health. That specific need for a physical diagnosis highlights the logistical trap patients fall into: calling dental clinics and asking for a flat price quote over the phone. If a receptionist gives you a fixed number for gum contouring before a dentist has examined your mouth, hang up. The price is determined by the scope of the reshaping. Carefully refining the arches over your 4 front teeth requires far less time and technique than mathematically balancing an entire upper arch. Second, the grade of the laser dictates the overhead. Clinics utilizing highly calibrated diode or Yag systems will price that precision into their fees. Relying on a blind phone quote practically guarantees a massive price shock once you sit in the chair and the dentist finally maps out your actual anatomy. The clinical consensus is clear. Peer-reviewed trials published on PubMed explicitly validate that laser-assisted gingivectomy results in measurably less bleeding and postoperative pain than conventional scalpels. The ideal candidate for this is a patient who has healthy teeth, standard jaw structure, documented excess soft tissue covering those teeth, and a need for a fast recovery. If your teeth are naturally short from grinding or your jawbone grew vertically, walk away from the laser. Look into veneers or orthodontics instead. To protect yourself, take this pre-consultation checklist into your first appointment. First, demand a digital or manually drawn mock-up of your proposed new gum line. Never let a dentist start cutting without agreeing on the exact visual target. Second, force the examining dentist to explicitly diagnose the structural cause of your gummy smile. Make them confirm it is a tissue issue, not a lip or bone issue. Third, verify the exact type of laser being used. Ask how many years of experience the clinic has operating that specific hardware. A pain-free recovery is a massive advantage, but the true value of laser gum contouring is taking a highly precise tool and deploying it against the exact right anatomical target.